Hi, everyone. Today we have our guest, Steve Costa, who is a traditional Chinese medicine practitioner who specializes in cancer rehabilitation and fertility and is based in Essex, London. Welcome, Steve, to Daughter of the Podcast. We're so excited to have you.
Hi, Tasha. Thanks for inviting me.
Welcome, Steve. So as your specialty, we would like to speak today about cancer patients in recovery. And to start off our conversation, I would like to bring up this research finding from the Cancer Research UK, which says that around 55,000 women are diagnosed with breast cancer every year in the UK, and 1 in 7 women in the UK will develop breast cancer in their lifetime. And interestingly, Cancer Research UK suggests that acupuncture is a method that may help with some symptoms and side effects of cancer or its treatments. So what would you be able to shed some light on this finding and your experience?
Hi, Gunny. Yeah, so it's interesting, isn't it? It's quite a frightening statistic.
Yeah.
And I think from a Chinese medical point of view, it just highlights how different everyone is and how everyone reacts to disease, and not necessarily disease, that everyone reacts to the environment in a different way. Because why would one person develop cancer and another person wouldn't? So obviously there's genetics are involved, and what we inherit from our parents and our genealogy. But we have to take into account dietary matters and pollution, emotions. How do we all react to everyday life? So it'd be interesting to see statistics, cancer statistics in years ahead, on whether it changed during the COVID pandemic and during lockdown, and the stress that created. And obviously there's going to be issues regarding diagnosis and treatment that was probably delayed during that period. But it'd be in Chinese medicine, disease is a reaction to how the outside affects our energy, which we call qi. And if anyone is not aware what qi is, the easiest way to sort of describe it is vital energy. So when your qi is affected, the way it moves, if it doesn't move the way it should move, then you have disease. So in cancer, obviously we know that it's to do with mutating cells. So it's the body that is essentially fighting itself. And it's an overstimulus, isn't it? So in Chinese medicine, we'd be looking at it's everything in Chinese medicine, but particularly when we're thinking about how the body attacks itself, it's often to do with the liver. Now, liver is like all the organs in Chinese medicine. It has an emotion that affects it, and it has certain foods and a certain mood that affects it. So the emotion that affects liver is frustration and anger, and just this feeling of not being able to move. Right. So when your energy is affected in that way, then it stops moving, and then you may get the tumours or something like that. So it's more complicated than that, obviously. But going back to your original question, Gunny, I think that the answer to that in why Chinese medicine helps is because it's very good at looking at an individual and how they respond to disease, whether it's the side effects of the disease, the symptoms of the disease, or the side effects of the treatment. And it can look at the person as an individual in a holistic way. Whereas the more sort of allopathic Western type treatments are sort of generic to everyone. So it can be a lot more gentle. So that's why we don't really go around trying to treat cancer. We try and treat the person.
Yeah, I think that's a really valid point. And I wanted to touch on what you said. So you say in Chinese medicine, kind of the main organs all have a related emotion tied to it, and also kind of the types of food that are linked to it as well, right? That is good or bad for it. Could you kind of shed some light, seeing that you work a lot with breast cancer patients, right? And in their recovery state. So where would you start for breast cancer patients in terms of emotions and food wise?
Okay. Well, so breast cancer is, most typically a tumor type of cancer. So tumors in Chinese medicine, we say that they are, there's different types of tumor, but just for the sake of argument, we say that we're looking at balls of phlegm, really. And so the phlegm in Chinese medicine is to do with an imbalance of the spleen, okay? Because spleen is, it helps move fluids, and it directs fluids. So and obviously when I'm talking about what organs do, I'm talking about Chinese medicine, because obviously we know in Western medicine, that's not what the spleen does. So the spleen is most affected by damp forming foods and stress and overthinking and just doing too much, really. So damp forming foods are foods that, like dairy, sugars, and anything that you shouldn't really be eating, like beige food. Anything that's beige is probably going to give you damp.
So many good stuff, like so many good things are in the color beige for food, like pasta, breads, croissant, anything, baked goods.
Well, I mean, basically, if you like it, it's probably not good for you.
Oh no. This is not really good news for me, Steve. You're not making me feel.
Well, it's all about balance, isn't it? So a little bit of something nice is always good, but when it's only nice, then you're heading for trouble. But you need to have a bit of joy in your life. So,
right. So yeah, you're saying that these dampening foods are probably not, or kind of triggers of where it would start when you look at.
I think so obviously we're not in the blame game, so we're not telling people that this is why you've got cancer. So because obviously everyone's different. So there's the person that runs marathons, has a vegan diet, meditates every day, and they get cancer. And then there's another person who smokes 20 cigarettes a day, drinks every day, eats what they like. They've got total beige in their cupboard, and they live to be 90 with no problem. So there's obviously it's how so from a Chinese medical point of view, it's how does everything fit together, and there's obviously something that's in that chain that's creating an imbalance, and that's why. So you can't. I don't think we should go through life trying to avoid disease. Because it become an obsession then. But there's obviously sensible things that we can do. So don't drink too much, don't smoke, only have beige food on your birthday and other people's birthdays. And obviously, so I think I mentioned in our chat earlier that in Chinese medicine we have an aphorism that says that qi goes where the mind goes. So if your mind is stuck or obsessive, or or it's got one of these emotions like anger that is overriding, then it's going to cause a problem. So it's good to have we need balance in our life. So, and that includes the mind. So if your mind is obsessive or stuck, then you need help. And I think that's the first place to start with. With health is to be honest with yourself. Where is your mind at?
Right. So interestingly, what you're mentioning with the mind, not only could be kind of some of having a healthy mind, not only does it participate in preventing some of those those illnesses, but now if we were to look at cancer on its own, and especially the recovery, because this conversation also I'd like to stress is that we're not saying that TCM or traditional Chinese medicine is here to cure cancer, because cancer has come to a point where it's chronic, and that's where you need allopathic treatments, right? But it's more like the recovery phase where most of them have undergone very aggressive treatment, and that affects their body, their mind, and their spirit to a certain extent. And so what are key factors or be it external or internal, that could affect that recovery process? Because if I were to see like a picture of, if I had to represent someone who undergone, because I had family members that underwent this, they're just drained by so much of all this medication, and so for them to come back to a certain normal life, if as I would quote to this, how can TCM help in that process?
Well, there's certain common side effects that people present with. Night sweats, hot flushes, nausea, fatigue, sort of mood type disorders such as depression and anxiety, and pain. They are the main things that I will treat people for. But I think firstly, I think what I try to stress to my clients, to my patients, is that life it's very difficult to be back to where you were pre-cancer, and I see that a lot with my clients, is that for instance, if they're runners, that they've gone through their disease, they've come out on the other side, and they're having treatment for recovery, but they're still trying to run marathons, and so what I think it's important for anyone through recovering from any disease is to understand that how ill they have been and how depleting it is. So you've got to be realistic, and I'm not saying that you're not going to be you will be healthy again, but you may not be the person you were before. It's a life-changing event, and I think it's a mistake to try to be the person you were before you were ill, because that might be you might be going back to something that wasn't good. I don't know. So there's certain aspects that it's really good to know about Chinese medicine, is that there's internal factors and there's external factors. So the external factors that we all know what these are. So it's the weather. So don't go out, like your mum said, don't go out when you've washed your hair with wet hair. Cover up your neck when it's a windy day. You'll catch a cold or you get a stiff neck. Don't sit on a damp floor. All this stuff is it's the cliches, but the cliches is a cliche because it's true. And so there's 6 aspects of weather that affect us, can affect our chi. There's the wind, the coldness, heat, dryness. So when I say heat, it's like fire, dryness, and there's one in between which we call summer heat. Which, I mean, being from England, there's only 2 things that I really understand, and that's dampness and cold, because that's all we get here. Right? So,
yeah, for sure.
But in a more hot country, like in South America or something, then you may have more heat type issues, or damp heat, or this thing we call summer heat. So they're the outside things, but also you have to take into account pollution and air conditioning and what we eat. So too much beige, or people live on chips and crisps and things like that. It's an imbalance. So and trauma is a huge factor, isn't it? So there's obviously some things that we have no control over. So, for instance, if you do a job that you dislike, it's going to be bad for your health. But you can't just leave your job, can you? Or you're in a relationship that is no longer working for you. It's very difficult to just say, well, it's not working for me anymore, I'm going. Because obviously you've got to think about children and pets and mortgages and everything. It's complicated, isn't it? So obviously then you have to. There's an element of work that's involved. You have to think, well, how am I going to change this? So then you may need help with that. And then we've got the emotions as well. So the main emotions that we talk about in Chinese medicine are anger, joy, worry, pensiveness, and that's a sort of Chinese translation of, I think,
overthinking.
Sadness, fear, and shock. And they're the 7 emotions we talk about in Chinese medicine. So where one of those emotions is in excess, it can cause a problem, or where the organ that emotion is attached to is out of balance, then that emotion can become either heightened or dampened. So a good example would be someone who's always angry, or someone who just can't get angry when they should be angry. But
anger is linked to which organ?
Liver.
Oh yes, you mentioned it. Yeah, right.
And the organ paired with the liver is the gallbladder. So and the sort of gallbladder is a yang organ, So it's more about action. So the gallbladder is, whereas the liver is about anger, the gallbladder is about decision making and what direction to go. So it could be if the gallbladder is not doing its job,
Right.
then you're going to get angry and frustrated because you just don't know which way to go. You know? But to say that that person's too angry, so they're going to have a liver imbalance, is too simplified, isn't it? Because we're so complicated.
And so these are like, I guess these would be contributing to the internal factors, like your emotions and trauma would be the internal factors, if I'm getting that right.
Yes. But obviously, I'm going to make it even more complicated because the climatic factor associated with liver is the wind. So if you out on a windy day and you have let's say that you do have a liver imbalance, then it can make you angry. So. And that explains why, for me, that on some days you go out and everyone seems angry, for no reason, or the mood is like really sort of down. Or on a sunny day, everyone's out and they're all nice and breezy, enjoying themselves.
And it's very apparent especially in the UK. No, in the UK, I'm telling you, when there's a ray of sun, you just feel the energy shifting, where people's mood, and it's very apparent. I feel that it's one of the cities that, especially in London, that it's so apparent where the weather really affects people's mood. And there's been research where decisions have been made because the weather was better than another day. So for example, this was like for funding for investors who've accepted to fund some startups, which were more successful on a sunny day than a rainy day.
Oh,
so
nice.
To say how, it's really a thing. And so kind of going back to cancer patient and their recovery phase and understanding that internal and external factors, how can TCM practically treat those imbalances?
Well, so I'm a specialist in acupuncture, and I also do a style of Chinese massage called Tui Na, which is basically it's massage techniques that use the same theory, is Chinese medical theory, same as acupuncture. So,
sorry, can I just ask, is that acupressure, Tui Na?
Well, it has aspects of acupressure in it. So we do acupressure, we do hitting, we do rubbing, we do pushing.
Okay.
It's very it's very similar to most massage techniques, but it's the reason it's different is because it uses the same theory as acupuncture.
Okay.
And or Chinese medicine. So how it helps is basically the way we place the needles will affect the energy in a certain way. So when I meet a client for the first time, we have a chat, we have a consultation, and I ask them questions about what they're experiencing, how they think I can help. So what symptoms are they experiencing, and then I'll ask them about their digestion, about their bowel movements, about their sleep, about any headaches, any aches and pains. So I try and do a thorough consultation, and that will give me an idea of how what their energy is doing, and then based on that, I can decide what points to use. So there's so we've got the organs, lungs, kidneys, hearts, liver, and spleen, and the sixth organ in Chinese medicine is pericardium, so which is the envelope that goes around the heart, or a heart protector, it's often called. So there's the six yin organs, and then you have six yang organs as well, which are paired to those. So it'd be liver, gallbladder, heart is small intestine. But yeah, so it would, based on the consultation, I'll have a better understanding of where the energy is stuck and how I can move it, and then that will tell me where to put needles. So on the channels, so each channel is connected to an organ, but along that channel, each point has a different action. So I will decide what channel to use. So what organ do I want to affect, and then how do I want to affect it, and that will tell me where to put the point on the channel.
Why do you think, or maybe what would be factors that would affect someone's kind of acceptance of the healing treatment that you're trying to administer?
Well, mind is a big factor, but it's not essential. So you don't have to believe it, because we know that acupuncture works with animals, and we know it works with children, and neither of those groups think about whether it works or not. So, but if you try and will it not to work, then it probably won't. So another aspect might be that you're just not having enough treatment. So the people that I treat at hospital generally have 6 treatments. Now that might be enough to start, but you probably need a bit more than that. And obviously lifestyle changes need to be made. So there may be things that are they're still doing that are affecting. So let's talk about hot flushes, for instance. Coffee is a known trigger for that. Stimulants such as chocolates, certain foods, stress will trigger it. So if you're not taking out the triggers, then it's still going to keep happening. So having a drug like tamoxifen or letrozole, one of both the common side effects are night sweats, but you've got to help yourself in a little bit. The triggers are still there. They're not having enough treatment, or it could be that the disease is very advanced. So
right, makes sense.
It could be that they've been mistreated. That they're on the wrong type of chemotherapy or preventative drug, or the wrong dosage. Because there's, with regard to chemotherapy, there's hundreds of different types of chemotherapy, different chemotherapy drugs, and everyone reacts differently to so that's a factor. And again, going back to the mind aspect, if you're in a in a relationship you don't want to be in a job you don't want to be in, you're feeling misunderstood, or you're not, just in a place that you don't feel good, it's going to affect your treatment. And obviously all of us are in all those categories. How much acupuncture do you have? How do we really know that we're having the right treatment? Because we're putting our health into the hands of someone else. How do we know that we're eating well? You've got to be honest with yourself. Like, am I doing what is best for me? But you still need joy in your life. You can't live like the monastic life when you crave company, or you crave a glass of wine every now and then, or a cake on the weekend.
So I guess, like, from what you're saying, to kind of like tie things in together, so you're saying that, like, patients who are in cancer recovery, they should be looking at kind of firstly, like, getting consultations outside of the allopathic space only, to see if that could facilitate their healing process and recovery process. And as one of it is acupuncture, when they see a practitioner, kind of look at the internal factors, external factors, and the lifestyle around these changes that are happening within them, right? To kind of facilitate that process and have it be effective for them, especially when they start venturing into the healing journey, right? And I guess before we close off, my question, like, for you is, like, for patients who are going through treatment, right, in chemotherapy or radiation, in that time, can they do something already that can be facilitating their recovery process, like, in that journey while they are getting allopathic treatment? Can they start their treatment then? And if so, like, what mindset or approach do they take with that?
Yeah, I think you can start acupuncture treatment at any point of the disease or the treatment or the recovery. There's certain things that would definitely need to be addressed. Definitely dietary factors. Definitely exercise. So it might be yoga or qigong or tai chi, something that's energy based and sort of mindfulness, and or as maybe even a spiritual aspect. Because something like running, for instance, is it's disconnection from the mind. I think exercise is good, but you can do too much or not enough. I don't know. It's about getting that balance. You certainly need to put your hands put yourself in the hands of someone who is an expert in that field. Like a doctor or an oncologist. But when you're strong enough, when you're ready, you need to start building up your own. How can you help yourself?
Right.
Because a doctor can't feel what you feel.
Right.
They can only sort of guess what you're actually feeling, and none of us feel the same. We're all individuals,
Yeah.
and you've got to go through. We don't have to go through it, but the choice is there. You can go through the allopathic routes, which is entirely up to the individual. But it's also a good idea to think, how can I empower myself? How can I be part of this healing process?
And I think that really is kind of like a good way to end our conversation, because to make people think about that, like, how do you take agency in your own health in the process of like any illness, or even if you don't get to a state of illness, which is actually what we all should thrive to not have, right? Any sort of chronic illness, then taking agency in our life, right, in our lives, to make sure that we are in control of our health. And I guess, like, Steve, I think we told you about our closing rapid fire questions that we've been doing. So maybe we can close off with the first question, which is, what is the worst health advice that you've ever received, ever?
Go to the doctor.
That's a good one.
Well, I'll go see an acupuncturist first.
Nice.
And if there was one habit we should all adapt, what would it be?
Daily exercise.
That's a good one. Very simple. And the last one is, if you were to put a song or a soundtrack to your life, what would it be?
Oh, it's got to be the Rocky theme.
Nice. we had another practitioner tell us the same thing.
All right.
Nice.
It's a thing.
Because it's the thing is, and it's also because you are also into martial arts, right?
Yeah.
So that's why it's very appropriate. Well, thank you so much, Steve, for coming on to our show and sharing your wisdom with us.
Thanks, Gunny. Thanks, Tasha. I really enjoyed it.
Thank you for coming on.